There are several decisions before starting a practice. 10 major business considerations or questions that an NP should ask his or herself before starting a practice is, with whom will I practice? There are advantages to both solo practice and group practice. The advantages to a solo practice include autonomy, efficiency of one-person decision-making, less income necessary to support one person than multiple people, no chance that another person's lack of productivity will affect one's business, and no one can fire the NP. There are advantages to group practice also. There's possible greater access to capital, possible shared call and office coverage, another source of expertise, social support, and possible economies of scale. There are many potential partners for NPs and many ways of aligning practices. In addition to the traditional solo practitioner or group of practice of professionals where patients come to the office and providers collect from insurance companies, there are hospital-affiliated practices, nursing home-based practices, employer-affiliated, and agency-affiliated practice. Another consideration or question that should be asked is, where will reimbursement come from? Reimbursement may come from any or all of 5 sources. These include government payers like Medicaid and Medicare, private insurance, which include health maintenance organizations, managed care organizations, and indemnity insurers. Reimbursement may also come from patients who pay their own bills. It may come from contracts or even grants. Another question to ask is, will reimbursement cover expenses? Many employed nurse practitioners thought, if I were in charge, I would never run the practice like this. But before going too far with this line of thought, a nurse practitioner considering opening a practice, and even an NP who expects to remain employed, needs to know how the numbers crunch in the business of primary care. It costs about $200,000 a year to run a primary care physician practice, not including physician compensation. These expenses include, but are not limited to, rent, payroll and employee benefits, quarterly state and federal taxes, office equipment, telephone and internet connection, and utilities. Another consideration is, how will I get patients to come to the practice? And this is something that really needs to be taken into consideration, because an NP who starts a new practice as opposed to buying an established practice will need to bring in patients with whom the NP has already established a relationship or attract new patients. Either way, there's cost to be involved. Whether the NP is seeking new or old patients, some marketing efforts will be necessary. Marketing can take the form of word of mouth, letters, flyers, advertisements, health fair shows, social media, web pages, or newspaper articles. Another consideration is, where will the practice be located? The location of the practice will determine how easy or difficult it is for patients to come. If the patient base that the NP is looking for is using public transportation or traveling on foot, then the practice must be on a bus line or in a neighborhood. If it's an inner city practice, but the patients are coming by car, then convenient and inexpensive parking is also a consideration. If the practice is looking for walk-in traffic, then a storefront location would be better than second-story office in a large building. Location can also have implications for practice income. In rural areas, there could be more opportunity due to less competition, but on the other hand, there could be too few patients to support a practice. In certain urban areas, there's actually a dearth of healthcare providers, whereas in urban and suburban areas, there's an oversupply. A study of locations of other providers is a prerequisite for choice of practice location.